Sheba?
Now to the fight against COVID-19 here in Georgia. Just 6 days after shattering the record for new single-day infections, our state broke the record again, this time by more than 1,000. We are no doubt seeing that post-Thanksgiving surge right now. More than 6,000 cases reported yesterday. The orange bar to my left here representing those infections. You can see it barely fits the graphic. That record number brings Georgia's total to more than 460,000 cases. And the number of people who died of COVID in Georgia is the highest we've seen this month, with the state reporting 50 new deaths. 6 out of Georgia's 14 hospital regions are reporting large numbers of COVID patients. 270 new hospital patients reported by the state yesterday, and some hospitals in the metro are already seeing a worst case scenario already. Tracy A. McPeer live in Atlanta with what one major healthcare system is doing to meet the demand. Tracy.
Well, the Northeast Georgia health system is already running close to full capacity, between 95 and 98% full, forcing them to open up another facility to have enough beds for all their critical care patients. Now, those patients include COVID-19 and non-COVID-19 patients, but are mostly those being treated for coronavirus. Early next week, they will open up a wing at Laurel Woods Mental Health Facility in Gainesville, giving them another 20 beds. Now, this is the second time in the last 7 months they've had to add another facility for patients. Dr. John Delzell says the choices people make during the next few months could make the situation better or worse.
Don't go to other places. Don't go to holiday parties. That's a disaster waiting to happen, really, in our area. We're already, at capacity. So if people start to, have Christmas parties or New Year's parties, that could really make things worse.
Now, Gainesville isn't the only place with hospitals near full capacity. Georgia has 14 different hospital regions. 6 of those are stretched so thin right now, they're having to open up different facilities to house all their patients.
And a major step in getting a COVID-19 vaccine here in the U.S. An FDA advisory panel of experts endorsing the emergency use of Pfizer's vaccine. Tracy Potts has the latest now from Washington, D.C.
Sheba, good morning. Good morning, everyone. An FDA panel has okayed the vaccine. Now we're waiting for final word from the agency on whether it's a go, as this virus continues to spread now faster than ever. Another day of record COVID infections and deaths.
We've never had to treat so many sick patients at the exact same time.
As the FDA weighs the recommendation from its advisors to approve Pfizer's vaccine.
So we do have a favorable vote.
Despite new concerns about allergic reactions.
We saw no serious allergic reactions.
Prep kits, masks, syringes, PPE are already being shipped nationwide. Pfizer sending nearly 3 million doses in the first week, protected by U.S. Marshals, to every state based on population. Back in Washington, there's no agreement yet on financial relief.
We cannot leave here without having a piece of legislation.
A lot of Americans simply cannot afford to wait.
More than 100 Republicans are backing the long-shot Supreme Court case led by Texas to change election results.
If they have wisdom and if they have courage, we're going to win this election.
Pennsylvania told the court that Texas has no standing to challenge what happened in another state. The Electoral College meets Monday to finalize the election results. Tracy Potts, NBC News.
And happening today, the CDC's Advisory Committee on Immunization Practices is meeting today. On the agenda, Pfizer's COVID-19 vaccine. They're planning to discuss recommendations for allocating initial supplies of the vaccine here in the U.S. This is the same committee that recently recommended healthcare workers, long-term care residents get the COVID-19 vaccine first. The virtual meeting begins at noon.